Welcome to another episode of Plastic Surgery Uncensored. Super excited. I have a very dear friend of mine, Jessica Maldonado.
Rady!
She's a famous, top-notch celebrity journalist and works for Telemundo, amongst many other things. We're going to be chatting about the Latinos, some of my favorite peoples,
Yes.
some of the Latino celebrities, who got it right and who got it wrong. So you want to definitely make sure you tune in and check out this episode. Welcome to another episode of Plastic Surgery Uncensored. This is your host, Dr. Rahban. I'm here today with a dear friend of mine, Jessica Maldonado.
Hola, Rady.
She is a top-notch celebrity entertainer, entertainment journalist. Also works for Telemundo, amongst many other things. And I'll have you give me a little bit of your bio. Today, we're going to be having a really interesting session about Latino celebrities. We did this segment and for the lay public, but I think the Latinos are, after the Super Bowl halftime, we got
a lot of attention.
Yes. So we're going to be chatting a little bit. So welcome. Thanks for being here.
Thank you, Rady. I'm so happy to see you. And,
Yes.
And I love you. And I think
Love you too.
you're a great surgeon. And I'm happy that we're doing this show about who got it right, who got it wrong.
Actually, our first podcast, my first podcast experience was with you in Spanish.
And you fell in love.
Yes, it was. I'm going to blame you for this whole thing. I remember coming and doing a podcast session with you in
Kate del Castillo.
Yeah. So, well, we're happy to have you. So let's start out with a little bit of basics about celebrities. You watch a lot of celebrities. You report on them a lot. You watch them through their careers, and you see some of them start out like so wonderful, so on the right path, and then sometimes they improve with time, and then some of them, they veer off track and arguably destroy their careers.
And I think that it has to do a lot, especially the social media. I think it has to do a lot with the era that we're in, where, everybody wants to look perfect and social media perfect, because you really live in like a make-believe if you really guide yourself through social media. So I think that also influences the celebrities. And then you start aging, and I consider, all of the women, we start aging, but society doesn't see women the same as they do men,
No, that's for sure.
So,
and it's not even so much that we want to see ourselves through we have no choice, especially if you're a celebrity. I was thinking about this the other day. You take the average person and you look at a few selfies, and you're like, oh no, that looks awful. What is that? And you're just a regular person on your iPhone. Now, amplify that by 1,000, and you're constantly being bombarded with photography, and people are taking photos of you when you're not ready, in the middle of chewing a half of a sandwich.
Yes.
You go up in the morning to go get some coffee, and all of a sudden you're going to look and there's a photo of you, because the reality is that people want to take you down. Mm-hmm. And so you live and die by the same sword, right?
Yes.
So you have the benefits of being a celebrity and all that comes with it, but then you have to live that lifestyle, and that lifestyle is obviously very challenging. So what is it like? Tell me when you see celebrities and you watch their career, some of the younger people, what is it that you see that they do that you're like, ¿por qué hiciste esto?
well, I think that especially like the young crowd, they do their butts, their lips, and big boobs. And I don't even think like the big boobs are in trend now.
Yeah, well, it's all relative, right? Because it's relative to culture.
Yes.
And so what's interesting is Latinos have historically always been very much in connection to the sensuality and the sexuality. So if you watch a telenovela, you go watch a soap opera today on American so-called mainstream TV.
They're all covered up.
You're going to see all kinds of people, overweight, underweight, young, old, transgender, blah, blah, blah. But if you go to the Latino channel and you flip through any of the game shows or still yet you go and look at a soap opera. I mean, everyone is like a vixen and a supermodel and Clark Kent, and everyone's super hot, terrible acting, but really attractive people. So that's the culture. Latinos have always been in the forefront of wanting to be attractive and desirable.
Mm-hmm. And I think we should start with Selena Gomez. I think, I've seen her in the red carpet, and I identify a lot with her because she has like a squared face. Mm-hmm. She's very
pull her
thin.
Up while you talk.
She's very thin. But she has a squared face. When I started very young. I've always had a round face. So for television, it's so. I would always tell the guys in camera, "Can you open up? Can you get my hips so they know that I'm not, overweight.
Right, right.
So when I see Selena Gomez doing the red carpet, I remember she performed. After a while, she was out of social media. She performed. Everybody started criticizing that she had more cheeks. That she was like overweight. She wasn't. Maybe
No, that's crazy. I mean, Selena Gomez, I got to see her not too long ago in person. She's beautiful.
Beautiful
and she's
face.
very sweet and very attractive and natural. And you like you said, some people have full cheeks. They're lucky. Some people have hollow cheeks.
You say lucky. That I don't think.
Listen,
lucky.
Let me tell you something. People are spending thousands of dollars filling their cheeks because a full cheek is a sign of youth. The problem is everything is about the perspective. People with full cheeks are like, oh my God, I look so fat. I want that gaunt look. People with gaunt faces are like, oh my God, I look so old and so thin and like unhealthy. I wish I had some. That's the nature of the world. But I'm looking at Selena Gomez and I think she looks beautiful. And she probably has, not probably, she's had lip filler. Mm-hmm. She's probably done some Botox. I mean, all the things that are basic. Nowadays, that would be the equivalent of having your nails done. Mm-hmm. But overall, she hasn't ruined her face by any means. Mm-hmm. I can't tell from this photo, but altogether, I think she looks really classy, and I give her a lot of credit.
Okay, now we're going to talk about, I think, Christina Aguilera.
Let me pull up her picture
Christina Aguilera, we've seen her also grow up. She started very young in the Disney Channel. Mm-hmm. And now, she's a mother. She got married. She got divorced. She has a great voice. She's so talented.
I'm looking at her photos here. So Christina Aguilera has a beautiful face. I think I can't say that I can't tell a lot on her face. I know she's done a lot of body work. Mm-hmm. I know she wears a lot of makeup. I know that she doesn't love her skin. I think she's really white. And I think she feels because, tan is considered in some cultures. Some people like to be super white. Isn't that interesting?
Yeah.
In some cultures, I think being Latina and tan is a desirable quality. But if you are in an Asian culture, they go out of their way to not get a drop of sunlight. And being porcelain white is considered incredibly desirable. So I know she wears a lot of bronzer and a lot of makeup to make her skin a little darker. Mm-hmm. But I know she had after her children, she had a breast work. Mm-hmm. Some of the photos don't look so fantastic, but I mean, I think nowadays when you have children, it's not unreasonable after your body changes to consider doing that. So I mean, all the power to her. But overall, I always think she looks pretty good. I think she hasn't done anything terribly off the rails.
Right. And right now, when you say that in Asia, they don't like any sun, I thought that they didn't want any sun because then you get the spots in your face and then you're going to look old.
No, the reason they don't do it is, no, I'll tell you why. And, there's many reasons for it. But one of the reasons is because it's a sign of wealth. You only get color when you're outside and you're a worker. When you're of an aristocrat background, you're indoors. And historically, people outside doing labor-related jobs got dark. So I think that's one of the reasons. That's why they wear the gloves when they drive.
They do, and the
umbrella, and they wear a visor. My wife is not Asian; she looks Asian, but she's got that Asian thing going where sun is her demon. She stays away from sun like crazy.
A demon. I like it. When I go out walking, I bought the visors, and I think in Little Tokyo, I bought the visors, so I won't get any sun on my face. But because of the age spots.
No, but the truth of the matter is that sun will absolutely 100% unarguable accelerate your aging. Mm-hmm. No questions about it. You're basically over the period of time with radiation cooking your skin. So increases your sunspots, increases your wrinkles, reduces your elasticity. Mm-hmm. So forget about the color portion. I like dark, I like light. Mm-hmm. From a standpoint of longevity, and that's the reason why my wife does it. Mm-hmm. She loves being tan, but she's more concerned about early premature aging, so she spray tans.
For instance, like if you get the sun on the body, a lot of people they cover their face and get the sun on the body. That's still going to make it age.
Well, then your body ages, and you get like décolletage starts getting all wrinkly. Your abdominal area gets wrinkly. Your knees get wrinkly, right?
Yeah, I've seen it.
I know. So
because I have very white legs, so
yeah, just keep them white and just use almond spray tan. Who cares? Just There's
like
self-tanners. There's all kinds of things. But I would say in general, stay clear of the sun. That's generally.
Okay.
So who's next? Who's next on our launching pad?
Isa Gonzalez. We're going to talk about Isa Gonzalez.
Let me pull her up.
She was born in Mexico, but she's done the crossover. She's here in the States now doing several Hollywood films. She was in Fast and Furious, and she's done other works and films here in Hollywood. And she dated for a while Hemsworth.
Oh, really?
Yeah, she dated.
People like him. He's
He's
dude.
cute. He's handsome. He's un bonbon.
All right. Well, I don't know about Bum Bum, but all right.
Okay.
So listen, there's not something interesting, especially when celebrities start young and then they get older. There's this effect, there's a beautification that occurs when you lose some baby fat. Mm-hmm. And so often when you look at a young celebrity or a young singer and they start in their 16, 17s and then they become 23, 24, as they age, it looks like they get cheekbones. They don't get cheekbones. They lose the fat in their cheeks. And as that hollows, there's a period of time where it looks really beautiful. It's only as they get older and older in their 40s and 50s that hollowness continues. And then they're like, oh, now she's looking old. But I'm looking at her photos from before and after. For sure, she did her nose. That's no question. And her nose obviously made a significant improvement.
Yes.
In this photo, at least, she didn't do her lips, which is astonishing that someone wouldn't have done her lips, which says a lot because her lips aren't necessarily huge, but they're attractive, but good for her. And what I see the most change in her, she looks more chiseled. She's got a very pretty angulated face. And I think that just happened, to be honest with you, I just think that happened over time. I think that just happened as a result of age. She lost some of the baby fat and her face has kind of gotten narrower than it was before. With the exception of her nose, I don't really know that she's done much other than just...
Yeah, and she totally, that change was amazing. I think
noses are incredibly, incredibly powerful.
And sometimes you think that maybe if you just change your nose, it won't make a difference. No. But it does.
Nose, but the number one change,
what is
your jaw, your chin.
But don't you think that when they do, because I've seen, celebrities when they do like their chin, it looks like you have something in there.
Well, that's the same thing with everything else. It's called selection bias. So that's like saying every time a celebrity does a facelift, they look weird. Well, that's because you're only looking at the weird facelifts. All the other facelifts that looks amazing, like Jane Fonda, you're like, wow, she looks so good. Yeah, because she's probably had 2 facelifts, but it was just done appropriately. So I'm a huge advocate of chin implants in the right person, done correctly.
How would you know who's the right person to get the chin implant?
You're going to have to go to med school with me.
No,
the right person is a person who has a weak jaw or a weak projection to their chin, and it creates sort of a jowly effect. It's hard to explain, but there's people who need it. You cannot have a beautiful face. Listen, if you go on, when patients come in for chin augmentation, this is what I tell them. I grab any magazine right off the rack, doesn't matter what it is, and I'll flip through 10 photos, and I'll say, okay, look at these next 10 people, man and woman. Tell me which one of them has a weak jaw. Never. Even in the era of ethnic diversity, all the Asian models, all the African-American models, all the Latino models, all the Middle Eastern models, everyone in a magazine has a strong jaw. They may have different eyes, they may have different noses.
You're right.
Not one person has a weak chin because you can't have a weak jaw and have a beautiful face. You can have a wider nose, maybe you can have sleepy eyes, but you cannot have a weak chin. That's 100% universal. So look at this girl right here. Look.
Yeah.
She's got a jaw. Look at Angelina Jolie. Look at Penelope Cruz. Go look at anyone you want to say is going to have a strong jaw. So that's super important. Very, very important.
Yeah, and do you think it's more popular now, the jaws, or it's always been?
It's always been that way. Everything is more popular now because we talk about it. Everything is more popular now because you have filler and you can sort of mimic it in the office. But jaws, I mean, if you look back in the 1950s, all the celebrities were beautiful jaws. Maybe we didn't discuss it the way we discuss it and analyze it, but we knew they were pretty. So who's next?
Okay, let's talk about Salma Hayek.
Ooh, I like Salma Hayek.
Salma Hayek. Yes, she's from Quetzalcoatlus, Veracruz.
Ooh,
she's from Veracruz. Veracruz.
Let me see where is Selma. Salma
Hayek.
No, right here, Selma.
Salma.
I always get Penelope and Selma mixed up.
Yeah. Well, we're gonna talk about Penelope too, but let's start with Salma.
Selma, you know what? She's just a classic beauty. She's got a gorgeous jaw.
Yes.
She has a square mandible.
Yes.
If you look at this, look at her mandible. It's like
Yeah,
that of a
it's
pit
like-
bull, right? That's the same way in Angelina Jolie. So as Selma has gotten older, she's gotten thinner. As she's gotten thinner, she still looks attractive. Why? Because her face hasn't melted off of her skin hasn't melted off her face because her jaw is so strong. So she's got even a better jaw than I do. So that's beautiful. She's got, I don't really think she's done anything. Her lips are still the same size. She's probably, microbladed her eyebrows. That's a given now. Nobody's eyebrows, look how thin her eyebrows were and how thick they are now.
No. She's always had, when she started, she had like very thick.
Well, then she stopped plucking them. How
Yes,
about that?
yes, she
All
did.
right.
I think she did.
Okay. And she did I'm pretty sure she did her nose. Her nose was a little more boxy. I would say the first thing any celebrity does is their nose. Like if you look at Lady Gaga, if you look at, you name it, Megan Fox, Jennifer Aniston, they're all going to do their noses. Then it goes up and up a notch as they need to do more things. But a nose is almost given.
When do you think a celebrity should stop? Because
And they start
sometimes,
looking weird. I mean,
but sometimes they don't notice. They start looking weird.
you know whose fault that is?
Who's?
Their doctor. So when a celebrity comes into your office who's under extreme pressure, who saw 3,500 photos of themselves that week, and they're like, oh my God, I think I need a facelift. That's the equivalent of your child coming up to you, mommy, I want another cookie. Is it the fault of the child for having the desire of a cookie, or is it a fault of the parent who handed them the cookies?
Well, the parent has to say no.
So then the doctors, you can't get get a facelift without the help of a surgeon. So the reason, and I always say this, the onus falls on the practitioners. If Salma Hayek walked in my office and looks as beautiful as this, and she's like, hey, Dr. Rahban, I think I need a chin implant, then it's my fault for giving her a chin implant. I'm the one who needs to say, Selma, you look gorgeous. I don't think you need it. It's a bad idea. So too much is when they go over the top.
And I think we're in that era where everybody, goes like too much.
Well, and the reason is because you constantly have to push the envelope. I mean, it's the same way in sexuality. Like it used to be sexy for you to wear lingerie. Now it's not sexy anymore. It's boring. Your stimuli you're overstimulated. So what used to be sufficient isn't anymore. So what happens is if you want to being recognized, you
have to show your butt.
You got to show.
social
Well,
media.
we're going to come back after the break, and we'll talk about some big booties and some big boobies. But yeah, I think the reality is that social media is a big player on that.
Yes.
Stay tuned. We're going to be right back with Jessica Maldonado after this break. All right, welcome back to Plastic Surgery Uncensored. I'm here, Dr. Rady Rahban, with Jessica Maldonado, our Latino entertainer expert. And what we're doing is we're kind of just, I think at the end of the day, celebrities really are the beacon of the direction of what we consider attractive and not attractive, right or wrong. We, my perspective, I think it's crazy that these people serve as anything, but the reality is, they are who they are. So let's kind of go through it and figure out, we were saying who got it right, who got it wrong.
Right.
We kind of moved away from the face and talked about a few Latino celebrities, but we know what makes Latinos really famous is their body.
And their body.
And we had a great sample of that at the Super Bowl.
At the Super Bowl, it was
Right.
like crazy. Everybody, now the Latinas are back in style again. Everybody wants to be.
Well, it just takes one shaking of the ass for someone to be back in style.
and they know how to shake it. There was an amazing show.
Yeah.
Shakira and J-Lo, and they have beautiful bodies, and they're girls that have worked out all their lives. They're dancers, they're singers, they're performers. But I think everybody started wanting to have like a butt like J-Lo because she's so fit and everything. But then the Kardashians came along, and then everybody started changing their style or the way.
Listen, beauty is an ever-changing platform. I just posted on my Instagram this thing about the 1920s, the 1950s, the 1980s, the 2000s, and the 2020 bodies. And they're all different. Some were boyish, some were really rail thin in the 90s when cocaine was just introduced. Then, and so on and so forth. So Cleopatra, for example, or women in the turn of the century would perhaps been fat and full because they're showed being rich. We talked about being very white skinned because you weren't a worker. So that's not unusual. It just pushed faster because of the technology we have. Before, you were modulating what you look like based on how much you ate and how you were born. Like if you were curvy and you were in the wrong generation, oops.
All right.
But now we can change bodies much more dramatically. And so, J-Lo reintroduced the concept of the butt.
But for me, working in television I started very young. I was very uncomfortable with my booty.
Because it wasn't popular. Because it wasn't
wasn't.
talked about like it is now. Now it's flaunted.
Yes. So when I saw J-Lo doing Selena, I remember I said, oh my God, this girl, I can relate to her. And, she's being accepted in Hollywood, because I've always wanted to be like a model, very thin. And I remember J-Lo told me, look, you're a Latina, we're women. And when you wear a dress, you need to wear it like a woman is wearing it, not a hanger.
Right.
And it stood with me, but now it's so popular now. With the booties are in style.
Yeah,
but
I like the fact that there's evolution and change, and that gives every woman a chance and an opportunity to be sort of desired and desirable. I think a couple of things that we need to note. Number one, when you look at J-Lo and you look at Shakira, both of which are moms, whether they had plastic surgery or not is not relevant. What's relevant is that they work out and they earn it.
Yes.
They're both out there. Nobody would have been able to run around for 20 minutes on the stage, up and down a pole, this, that, the other, and not even
on heels
and singing, no less, and not be gasping for air. So you can take a look at J-Lo ever since she was with A-Rod. She's ripped now. I mean, she's got like biceps.
Yeah.
So she earns it. We can give her that. I think the thing that makes them desirable, and I think this is the thing that people are missing, is the context of the physique. What does that mean? They're beautiful because they're sexy. They're sexy because of who they are and what they represent. Shakira is like 4'11". Most people don't know that Shakira is tiny and compact. If Shakira didn't have if Shakira didn't have the hair and makeup done, was wearing sweats and flip-flops and walked through the supermarket, I assure you wouldn't look at her as a sex symbol. You would be like, oh my God, damn, check her out. You'd be like, you're a pedophile, stop looking at her. That's ridiculous. But because she gets on stage and has a persona and she's sexy and she dances and she's got talent, you find her attractive. And so that's the missing piece here, people. Attractive people are more than the way they look. Much like if someone's incredibly pretty and has a horrible personality, which we all know or dated. I've went on a lot of dates, so I know. It's very off-putting.
Right.
So let's not forget about J-Lo and
that they're very secure of their persona. They're very secure.
Well, they're confident personas, right? So that's what I'm trying to say. They're not arrogant personas because that's part of the unlikable. They're very proud and own their bodies. And yes, of course, it's easy to own their bodies. Well, no, not necessarily. It was a time where being curvy wasn't in, and J-Lo still liked being in her own body.
Yes.
It just, I think that people
She changed the scale in
she was definitely
beauty.
an icon in regards to
yes.
what we consider attractive, much like Pamela Anderson was in regards to
her big boobs.
Her big breasts, much like Dolly Parton was. Like there's all going to be these people when you look back historically, and that's how everything is. And
now that we're talking about the butt, Alejandra Guzman is a very popular, beautiful, attractive singer that's been in this industry for many years, who's a dancer, who's a great performer. So she sells out, here at the Greek, she performs all over the place. And recently and I came to interview you for Telemundo for Al Rojo Vivo, what we talked about.
Yeah, I remember her.
She went to this clinic and they gave her some shots. She works out all the time. She has a beautiful body because she's danced all her life. And this plastic or whatever the injectables they did on her butt almost made her lose her life.
Yeah, I mean, what you just described, that story has 20 crucial elements. Number one is people think because rich people or famous people don't have to must go to the best. Not at all. If she's Alejandra Guzman, why the hell is she going to some spa in some shady ass place? She should go to the world's best, which she didn't. Second thing is this idea that someone who is as popular, as famous, as in shape as her, she would have no insecurity. Clearly that wasn't the case because she went and had crap injected in her butt when she was not only just fine, but looked great. So even her has a point of reference where she's looking at herself feeling insecure. Another thing you point out is having crap injected in you that you don't even know what it is. So how on earth can you, as an intelligent, capable person, go somewhere and have someone come in with a syringe that you don't know what it is and inject a material, a substance that is not indicated to be injected in human tissue, be injected in you and then nearly die because it gets infected and causes granulomas. So hear that one story, which by the way is echoed over and over and over and over again. In Miami in particular is not the only place, but one really popular place where there's these sort of underground booty clinics where people who can't afford things are getting things done. And as you can see, people who can as well. So that topic, the fact that butts became so desirable and then necessary, forcing people to take their lives into risk because they have to have it. I mean, look at that craze. It's nuts.
And you know, I think, and I always tell when they send me messages or something, oh, Jessica, so you know doctors, who do you recommend? Oh, but he's very expensive. I always say, save up money. Instead of buying a nice purse or pair of shoes that are
or iPhone
800.
78.
Yes, exactly. You know, just save that money. And when you have your money together, then go to the best.
No, but that brings, I mean, so that's exactly, so this is the funny thing. I mean, we have people constantly come in. Of course, just because you pay more doesn't mean you get more. No. But absolutely when you pay less, you get less. So that's crucial for you to understand. So I never understand this. I have people who come to my office. They come with all bunch of things they don't need. They have two phones, iPhones, each of which are $1,200 now. Yeah. They have, let's say, you know, a Birkin and this, that, the other. And then when it comes to paying for their procedure, the thing that can kill them, the thing that's going to be with them forever, they can't afford it or whatever. And so it's always very fascinating, the prioritization of people when it comes with how they spend their money. And then when they want the surgery because they want it here and now. I want it now. Well, why don't you save for 6 months?
Yes.
No. I need to have it now. Why now? Why not later? No. And so then they do things that are stupid and foolish, and they go get a Groupon butt injection, and you know the rest of that story.
Exactly. Okay, so now we're going to talk about Sofia Vergara.
Oh, yes.
She's from Colombia.
Colombiana.
Colombiana, hermosa. You know, she's done a great career here in Hollywood. I think she looks amazing.
Yeah, Sofia is one of those people. So again, the question, people love to know, let's just assume that she did do stuff. Let's take that route. Good for her. She looks great.
Yeah.
So if it's hers or if she did it is not really the question, although everybody wants to know, because people want to know that it's not really hers, because then they'll feel bad about themselves. They want to know she bought it.
No, she was born beautiful. And when I started working in television, I was working in Univision. She was there with a show that she had. And I remember when I saw her in person the first time, she's a stunning, beautiful face, but the biggest boobs I've ever seen in my life.
Yeah. And it's quite common within certain cultures. Russians have very large breasts. Latinos have very large breasts. Middle Easterners have very large breasts. So
but hers were natural, because I remember it was like, and I remember she would always say, oh my God, I just want to get rid of this. But I think that, the show was like, she got so many ratings that they said, oh, don't touch yourself. You stay like that.
Yeah. Well, I mean, part of her, listen, she big part of her career is that she really epitomizes curvy Latina, enfuega woman. For her to mess with that image would be almost suicide. She's curvy. She's got big boobs. She's got long black hair.
And she's tall.
And she's pretty. And she's got, that voice. Mommy, you know what I mean? So she can't, that's her. She's, why would you ruin that? It's working great. I think she looks fantastic.
Now let's talk about the men. I think Luis Miguel.
Men don't do anything.
Yeah. Oh, they don't do anything. They do a lot.
Yeah, that's true.
Luis Miguel, the crooner, he used to date Mariah Carey, by the way. He has a great voice, talented, and he dated Sofia too. He dated Sofia
at the same time.
No.
I was going to be like, one of them.
I was going to say Luis Miguel has dated like so many beautiful amazing, talented woman. So Luis Miguel, obviously he's changed. He's older now. But what do you think about Luis Miguel?
I think this is the funny thing. Men who do plastic surgery are under much more scrutiny than women who do plastic surgery because the margin of error is much smaller. So what does that mean? A woman who does plastic surgery, we have a much greater degree of acceptance of what is still pretty, even though it's overdone in a woman. In other words, a woman gets her nose done and she looks really overly refined. She can still be attractive. You're just going to know, wow, look, she did her nose. A woman gets her boobs done. They're really large. She can still be desirable and attractive. You just look at her and be like, wow, those are some really big boobs. A man gets his eyelids done, and if it's ever so slightly too much, he looks weird. If he gets his facelift done and it's a little bit too pulled, wow, he looks odd. What a weird looking nose on that guy. Because men are not visualized the way women are. We look at men for personality, character, machismo, confidence, and power. We look at women for delicateness, feminineness, beauty. Of course, there are other characteristics and things of that nature, but the way we look for attraction, we look at women attractively, very visually and dainty, and men have to be rugged and whatever. So when men do plastic surgery, if it's ever so slightly too much, they look feminized, and then they look weird. So he looks good. I looked at the photo earlier. I mean, I wouldn't be surprised if he had a facelift. There's nothing wrong with that. You just need to do it a little more conservative in a man than in a woman. I think overall he looks good.
There's a singer, and I'm going to have Maria look for the Fernando of Maná.
I love Mana. Don't tell me he looks weird.
No,
I'm
well,
not going to be able to sing. Listen to the music anymore.
He got a very bad rap when he appeared on a press conference, and they were saying, "Oh my God, his surgery went wrong," and people were saying, "I just thought he was aging because something was different," but
Yeah.
The way he looked, the way
his eyes, right? This is the Kenny Rogers. Is it Kenny Rogers or Kenny Loggins?
Yeah,
Kenny Rogers. You cannot F with a man's eyes or a woman's, but men. He's got beady eye syndrome, right? He looks weird. I mean, Al Pacino looks like he's 180. My wife still thinks he's handsome, right? Sean Connery. Men just don't do well when they're overly feminized. Yeah, he looks weird because his eyes are beady. They're little. He also had.
So what happened there? What happened?
Number one, well, they did an eyelid surgery. So when you do you do the lower eyelid, and the corner of your eye is made tighter, it makes the opening of your eye smaller, and so you get beady eye syndrome. Like the eyes just generally look smaller. So that's not desirable. Additionally, he just looks. His eyebrows look a little bit elevated. Like raised.
So that means they did like...
Yeah, it's possible that they did a little bit of a brow lift. That never looks good in a man. I mean, even a 22-year-old man's brows are almost straight and droopy. And so it doesn't.
So you don't recommend eye lift?
Here, look at this photo. You'll understand immediately. Look at him when he was young and handsome.
Yeah.
Straight eyebrow, right? Straight across.
Right, yeah.
Now look at his eyebrow on the other one.
He looks like a genie, I think.
Okay, so because it's feminized. Right? So you're doing the same procedure that you would do in his wife, but you're doing it in him, and you can't because when your eyebrows go arch like this, it looks feminine. So there goes all of his manliness. So as I'm telling you, you won't get away with it. Men are much more difficult to do surgery on and look natural.
But still, a lot of men are still coming
yes, of course. 20% of my practice is men. I'm not saying they shouldn't. I'm not saying they should be afraid of it. I'm just saying be careful. So when I do a male rhinoplasty, I do a ton of noses. My male noses have to remain super strong and still present. Whereas if a woman says to me, Dr. Rahban, I'd like one a little bit more refined, we have a little more wiggle room. If a man says to me he wants his nose refined, that's no.
Not a good idea.
Not a bad. That's terrible. So yes, I definitely think he did his eyelids and eyebrow, and that's what ruined him, like Kenny Rogers.
Yeah. So when he went to the press conference, we said, "What happened?"
The other thing is that women wear makeup, and women have other ways of complementing it. So a woman doesn't suddenly change, right? She's been putting on our makeup and tattooing our eyebrows, and whereas a man usually doesn't have that much makeup. And so when he comes in, he had plastic surgery done, particularly in his late 50s, early 60s, it's dramatic.
So when should you start? When should you start if you want to start making like upkeep or not, age well?
I mean, listen, there's two approaches to plastic surgery. I refer to them as the gas tank analogy. There are individuals who wait until the last second. There's no drop of gas left. There's no drop of gas left in the tank, and they only fill their gas tank when it's almost run out. And there's people that constantly fill their tank whenever they see a good deal or they're nervous that it's going to run out. So the same is true of plastic surgery. Some people will only do plastic surgery when they have no other choice. Like, well, holy shit, now it's my face just looks terrible. I have to do it. I have no choice. And other people are like, I'm going to do this before I need to do it. As soon as I see the slightest change, I'm going to nip it in the bud. There is no right or wrong way. You should do plastic surgery when you feel ready to do plastic surgery.
And when you did it and it went wrong, is it more complicated to
100%.
make it well?
Yes, no doubt about it. Fixing a botched job, aside from being incredibly difficult and aside from being much more expensive, you will never get back to where you would have had you done it right the first time. So super, super important. I love it. Wow. That was good. Very, very good rundown of the Latinos entertainment crew. So anyway, it was a pleasure having you on this segment.
Thank you, doctor.
Gracias.
Gracias. Guapo.
Muy amable.
Y tú también,
All right.
guapo.
I like that, guapo. Tune in for our next episode of Plastic Surgery Uncensored. Thank you for listening. And remember always to share this with your friends. Don't forget to subscribe and most importantly, download. Download. Thank you.